You know those classic bullseye rashes? Everyone thinks Lyme disease, right? Well,
Mm.
guess what? They're not as common as we think.
Yeah, Lyme disease can be a real trickster. It can look like so many other things. Makes it really hard to diagnose sometimes.
Yeah, for sure. Lyme disease is way more complicated than people realize.
It really is.
We've got a ton of research here, and we're going to dive deep into it today.
Yeah, we're going to look at the bacteria, the ticks that spread it, and we'll talk about the crazy ways Lyme disease can show up, especially how it's different in kids versus adults.
That's exactly what we're unpacking today, the complexity of Lyme disease.
Yeah.
We'll try to figure out why it's so hard to diagnose and why some people still have symptoms, even after treatment.
Definitely a deep dive, but I think by the end you'll have a much better understanding of this tricky illness.
Sounds good. So let's kick things off by meeting the bad guy
Hmm.
behind Lyme disease, Borrelia bacteria. Most people only know about Borrelia burgdorferi.
Right, but there are actually a bunch of different species that can cause Lyme disease, and even within a species, you can have different strains.
Different strains. Like what?
Well, some strains are more aggressive, some are better at hiding from your immune system, and some cause disease in really strange ways.
Okay, so multiple species, different strains. This is already getting complicated. But why does it even matter?
Well, understanding the specific species and even the strain involved could help us understand why Lyme disease looks so different in different people. It could even help us figure out why some people have it worse than others.
So maybe one strain causes a bullseye rash and another one causes like completely different symptoms.
Exactly. And this is where it gets even more interesting. You might be surprised to hear that there's this species of Borrelia aceli, and it's really strongly linked to this chronic skin condition called acrodermatitis chronica atropicans. We call it ACA for short.
ACA. What's that? I'd never heard of it.
Well, it starts with a reddish or bluish discoloration of the skin, usually on the hands and feet, but over time, the skin actually starts to thin out.
So it's like a long-term skin problem that can be a symptom of Lyme disease.
Exactly. And here's the thing, ACA is much more common in Europe and Asia, where that particular Borrelia species is more common. But it's pretty rare in North America.
Wow, so where you get bitten by a tick can actually influence how Lyme disease shows up.
It really highlights how global this disease is and how different regions might have their own, unique Lyme disease challenges.
This is fascinating. Okay, so we've met the culprit, those sneaky Borrelia bacteria,
Yeah.
but how do they actually get into our bodies? It all comes down to that tiny tick, right?
Yep, the tick is definitely the accomplice here.
But it's not just any tick, right?
No, it's a specific type. We're talking about the ixodes tick, which some people call the black-legged tick or the deer tick. And their life cycle is actually pretty fascinating.
Yeah, it can take 2 whole years for the Ixodes scapularis, that's the kind common in the eastern U.S., to go from egg to larva to nymph to adult. And here's the thing. They need a blood meal at each stage to survive.
They're like tiny little vampires, always searching for their next meal.
Exactly. And it's during one of these blood meals, usually from a little animal like a white-footed mouse, that the tick picks up those Borrelia bacteria. But here's a fun fact. Larval ticks aren't born infected. They actually get infected during their very first blood meal.
And white-footed mice are like the perfect host for Borrelia burgdorferi. In areas where Lyme disease is common, a lot of those mice are carrying the bacteria, making it super easy to pass it on to those unsuspecting larval ticks.
Oh, wow. So the mouse is kind of like the typhoid Mary of Lyme disease?
In a way, yeah, they're a really important part of the Lyme disease ecosystem.
But back to the tick's life cycle. So we have this little infected nymph tick, and its next meal is often a human.
Right. And that's how we can get Lyme disease.
And the nymphs are the main culprits when it comes to spreading Lyme disease to people, right?
Yeah.
And that's where it gets really dangerous. Because those nymphs are so tiny, we often don't even notice them. It gives them more time to latch on and transmit those sneaky bacteria.
Exactly. That's why preventing tick bites is so important. Knowing where ticks live, wearing the right clothes when you're outdoors, and checking yourself for ticks afterwards can make a huge difference.
Totally. Okay, so we've met the villain, those Borrelia bacteria, and the accomplice, the tick. But how does Lyme disease actually show up in the human body? We know it's not just the bullseye rash. What else should people be looking out for?
Well, Lyme disease often has 3 phases:
Mm-hmm.
early localized, early disseminated, and late. But it doesn't always follow those stages perfectly. They can overlap, and some people might skip a stage entirely.
And to make it even more complicated, not everyone experiences Lyme disease in the same way, right?
Right. The symptoms can be different depending on the person, the species of Borrelia involved, and even the strain. For example, kids are more likely to get Lyme meningitis, which is inflammation of the membranes around the brain and spinal cord.
That sounds really serious.
It can be, but luckily with treatment, it usually goes away without any lasting problems, especially in kids. But it just goes to show that Lyme disease can act differently in different age groups.
So it's not just about the physical symptoms themselves, but also who's experiencing them.
Exactly. The context is really important.
Okay, so Lyme disease is a bit of a chameleon. It can look like other things and show up differently in different people.
Yeah.
But how do doctors even begin to diagnose this tricky disease?
The main way is through serologic testing. That's where we look for antibodies to Borrelia burgdorferi in the blood. These tests are most accurate in the later stages of the disease.
But we already talked about how sneaky Lyme disease can be, and those early symptoms can be really vague. How do we catch it early on?
That's where it gets tough. In the early stages of Lyme disease, those serologic tests might come back negative, even if you actually have the infection.
So we can't just rely on those tests, especially in the early stages.
Nope. That's why what the patient is experiencing, especially if they have that rash, is super important for making the diagnosis. It's all about looking at the whole picture: symptoms, possible exposure to ticks, and the limitations of the tests themselves.
So it's like solving a puzzle. But once we have a pretty good idea that it is Lyme disease, what happens then? How do we treat it? What are the long-term effects?
The good news is if we catch it early, Lyme disease usually responds really well to antibiotics.
That is good news. So how does that work? What kinds of antibiotics are we talking about?
It really depends on how far along the disease is, and things like if someone's allergic to certain antibiotics or if they're pregnant. But usually we go with doxycycline.
Doxycycline. Why that one specifically?
Well, it works great against Borrelia burgdorferi, and as a bonus, it also takes care of some other tick-borne infections you can sometimes get along with Lyme.
So it's like a double whammy.
Exactly. Plus, most people handle it pretty well.
Okay, so doxycycline's the go-to for early Lyme disease. But what if it's not caught early on? What about those more serious cases?
Well, if the infection's gotten to a later stage, say Lyme arthritis or problems with the nervous system, then they might need antibiotics longer, maybe even through an IV.
5V antibiotics. That sounds a lot more serious.
It can be, yeah. But even in those later stages, Lyme disease is still treatable. The main thing is to wipe out the infection and stop any more damage from happening.
So early treatment is always the best, but even if it progresses, there's still hope.
Absolutely. Now, let's talk about those different stages and how they show up. Remember those 3 phases we talked about? Early localized, early disseminated, and late.
Right, right. Let's break it down. Starting with early localized Lyme disease. What should we be watching out for?
Okay, so in this early localized stage, the main thing you'll see is that erythema migrans rash, or EM for short. It usually shows up where the tick bit you, anywhere from 3 to 30 days afterwards.
But didn't we say not all EM rashes look like that classic bullseye?
You got it.
Yeah.
It might just be uniformly red or maybe a subtle clearing in the center. Sometimes people even mistake it for a normal tick bite reaction.
So how can you tell if it's just a reaction to the bite or if it's actually that EM rash?
There are some telltale signs. That EM rash tends to expand over time. It slowly grows out from where the tick bit you. It can even get bigger than 8 inches across.
8 inches, that's huge. So it's not just a small red dot. We're looking for something that's actually growing.
Exactly. A normal tick bite might be red and itchy, but it usually fades after a couple of days. But EM, that sticks around, and usually it keeps growing.
Oh, and if you start feeling like you have the flu along with that growing rash, then definitely go see a doctor.
Okay, so we're watching out for a rash that's getting bigger and maybe some flu-like symptoms. What happens if it's not treated at that early stage? What does early disseminated Lyme disease look like?
So in early disseminated Lyme disease, those Borrelia bacteria start to move out from where the tick bit you, and they spread throughout the body. This usually happens a few weeks to a few months after the bite. And this is where it can get more serious because now the bacteria can start affecting different organs. So it's not just a skin infection anymore, it's getting into the rest of the body.
Exactly. And one thing you might see is multiple EM lesions popping up. That means the bacteria have traveled through the bloodstream.
So more than one rash is a sign that it's spreading.
Absolutely. Also, at this stage, people can start having neurological symptoms.
Like the Lyme meningitis we talked about before.
Yeah, meningitis is definitely possible, especially in kids. But sometimes there's also something called facial nerve palsy, where the muscles on one side of the face get weak or even paralyzed.
Oh, wow. How common is that facial palsy with Lyme disease?
It's actually one of the more common ways Lyme disease shows up in the nervous system, but luckily it's usually temporary, and with the right treatment, most people recover completely.
Okay, that's good to know. So early disseminated Lyme disease can affect the skin and the nervous system. What about the heart? Can it get in there too?
Unfortunately, yes. Heart problems, or what we call Lyme carditis, can happen in this stage. It's not as common as those neurological symptoms, but it can definitely be serious.
What exactly happens with Lyme carditis?
Usually, it involves some level of what's called heart block, where the electrical signals that control your heartbeat get messed up. This can cause dizziness, fainting, and even heart palpitations.
Definitely not something you want to ignore.
Mm.
Okay, so early disseminated Lyme disease can affect the skin, the nervous system, and maybe even the heart. What about late Lyme disease? What happens if it goes untreated for a long time?
Well, late Lyme disease can cause chronic arthritis, mostly in the big joints like the knee. It usually comes and goes, but it can be really painful and make it hard to get around.
So you can get Lyme arthritis years after that initial tick bite.
It's possible, yeah. And this is why it's so important to catch and treat Lyme disease early because these later complications can really impact your life.
But wait, I thought you said Lyme disease is usually curable with antibiotics. How can someone get those late-stage problems if they were treated?
That's a great question. And to be honest, researchers are still trying to figure it out. Early treatment usually works really well, but there are some cases where people still have symptoms even after treatment.
Is that what post-treatment Lyme disease syndrome is all about? PTLDS?
PTLDS is a little different. Those symptoms usually start after the treatment's finished, but there are some people who develop late Lyme disease, like that chronic arthritis, even though they got the right antibiotics.
So even if you get treated, there's no guarantee that Lyme disease won't have lasting effects.
Sadly, that's true. There's still a lot we don't know about why some people have these long-term issues while others recover completely.
Okay, so late Lyme disease can mean chronic arthritis and maybe some lingering neurological problems, but why do some people still have symptoms even after treatment? What's the deal with that?
That is the million-dollar question, and honestly, we don't have a clear answer yet.
But I'm sure there's some theories floating around out there.
There are a few. One idea is that even after the antibiotics kill the Borrelia bacteria, some little pieces might be left behind, and those pieces might be enough to trigger the immune system.
So it's like the body's still fighting something that's not even there anymore?
Yeah, kind of like that. Another possibility is that the infection, even though it's gone, caused some damage to the body's tissues or its immune system, and that damage is causing the symptoms to stick around.
So even though the bacteria are gone, the damage is already done.
That's one theory. It's complicated, and we need more research to really understand Lyme disease and why it has these long-term effects in some people.
Okay, so there's still a lot we don't know about Lyme disease, especially those long-term effects. But let's get back to diagnosis for a minute. We talk about those serologic tests, but are there any other ways doctors figure out if someone has Lyme disease?
Those serologic tests are really the main way, especially for those later stages. But early on, when those tests might not be accurate yet, it really comes down to the doctor's judgment.
So they have to look at everything the patient's symptoms, whether they might have been exposed to ticks, and of course that rash.
Exactly. And sometimes they'll order more tests depending on what symptoms the person has.
Like what? What kind of tests?
Well, let's say someone has neurological symptoms like meningitis. In that case, they might do a lumbar puncture. That's where they take a sample of the fluid around the brain and spinal cord.
Can you explain what a lumbar puncture is for those who don't know?
Sure, sometimes it's called a spinal tap. Basically, they insert a needle into the lower back to collect some of that fluid. Then they can analyze it to see if there are any signs of infection or inflammation.
So if they think someone might have Lyme meningitis, they'd be looking for evidence of the Borrelia bacteria in that spinal fluid.
Exactly. They're looking for signs of inflammation or even specific antibodies to Borrelia burgdorferi that can really help confirm if those neurological symptoms are because of Lyme disease.
So it helps them connect the dots between the symptoms and the actual infection.
You got it. And if they think the heart might be involved, they might order an electrocardiogram, or EKG. That's a test that checks the heart's electrical activity.
So diagnosing Lyme disease is a whole process. It involves the doctor's assessment, those serologic tests, and maybe even other tests based on the person's symptoms. It's not always simple, but by looking at the whole picture, doctors can usually figure out the right diagnosis.
You're absolutely right. And once they know for sure it's Lyme disease, they can start the right treatment.
And speaking of treatment, we touched on antibiotics earlier, but let's dig a little deeper into that.
Like we said, early treatment with antibiotics is really important. Which antibiotic they use and for how long really depends on how advanced the Lyme disease is and things specific to the patient.
So there's no one-size-fits-all approach.
Definitely not. But doxycycline is often the first choice for early Lyme disease.
We've talked about doxycycline a few times now. What's so great about it?
For one thing, it's effective against Borrelia burgdorferi, and it also works against some of those other tick-borne infections that can hang out with Lyme disease.
So it tackles multiple problems at once.
Exactly. And most people tolerate it pretty well. But there are other options too, like amoxicillin and cefuroxime.
And what about those later stages of Lyme disease, like Lyme arthritis or those neurological complications?
For those, they might need antibiotics for a longer time, and they might even need them intravenously.
Intravenously, huh? That does sound more serious.
It can be, yeah. But even at those later stages, remember Lyme disease is treatable. The goal is to get rid of the infection completely and stop it from doing any more damage.
Okay, so treatment is tailored to how severe the infection is. But what about those people whose symptoms don't go away even with treatment? What can be done for them?
Unfortunately, that's an area where we still have a lot to learn. There's no proven treatment for PTLDS, so doctors usually focus on managing those specific symptoms like fatigue, pain, or cognitive problems.
So it's more about relieving the symptoms rather than actually curing the underlying cause.
Yeah, that's the idea. It's really important for people with those persistent symptoms to find a doctor who understands Lyme disease well and is willing to work with them to manage those symptoms, because it can be a long and frustrating road.
I can imagine. It sounds like there's a lot of research going on to try and understand PTLDS and find better treatments.
There is. Hopefully, more research will give us more answers and better ways to help people with Lyme disease, both in those early stages and in those more challenging long-term cases.
Well, we've covered so much ground here today, from those tiny little ticks to those complicated diagnostic tests, all the way to those long-term challenges of PTLDS. It's been a real deep dive. Any final thoughts before we wrap things up?
I think the most important thing to remember is that Lyme disease is more complex than most people realize. It's not just a simple bullseye rash. It's a multifaceted disease that can show up in so many different ways.
And early diagnosis and treatment are super important.
Absolutely. If you recognize those early signs and get medical help quickly, you have a much better chance of avoiding those more serious complications.
And for those folks who are dealing with long-term effects, it's really important to find a doctor who understands Lyme disease and can help manage those symptoms.
Exactly. And hopefully, with more research, we'll have more answers and better ways to support people with Lyme disease in all its forms.
Well, this has been a really informative discussion about Lyme disease. It's definitely a condition that's often misunderstood. But I think understanding the nuances of Lyme disease,
Yeah.
the different species and strains of Borrelia, those tricky diagnostic tests, and all the different ways it can be treated can really help us protect ourselves and the people we care about.
Absolutely. Knowledge is power when it comes to our health.
Before we move on, I want to go back to something we talked about earlier. The fact that Lyme disease isn't just a problem in North America, it's a problem in Europe and Asia too, right?
Hmm.
And we were talking about those other species of Borrelia like B. Celia and B. greeni being more common over there. So does that mean the symptoms or like the severity of Lyme disease are different in those places?
There's definitely some research that points in that direction. For instance, B. Fazeli is really strongly linked to this specific skin condition called acrodermatitis chronica atropicans, or ACA. It's a chronic skin thing that starts with like a reddish or bluish discoloration, usually on your hands or feet, and it can actually make your skin thin out over time. ACA is way more common in Europe and Asia, practically unheard of in North America.
So the type of Borrelia can really change how Lyme disease looks. What about those different strains within a species? Do they play a role in all this variation too?
They absolutely can. Studies have shown that some strains of B. burgdorferi, for example, are more likely to spread beyond that initial tick bite. We call that disseminated infection. And some strains seem to be linked to a higher chance of developing Lyme arthritis.
So some strains are more adventurous, huh? Like they want to travel around the body? And some have a thing for joints. This Lyme disease is so complex.
It really is. And to add another layer to all this, we also have to remember that people can actually get Lyme disease multiple times.
Yeah, I mean, you can get it again. I thought once you've had it, you're immune.
It would be nice if it worked that way, but unfortunately, no. You can definitely get reinfected with Borrelia burgdorferi even if you were treated for it before.
So the immunity you build up, it doesn't stick around forever.
It might offer some protection, but it's not a guarantee. And if
Mm.
you live in or spend a lot of time in areas where Lyme disease is common, you're just exposed to those infected ticks more often, so the chances of reinfection are higher.
So even if you've already dealt with Lyme disease, you still got to be careful and prevent those tick bites.
Exactly. Tick checks, wearing the right clothes when you're out in nature, and using insect repellent are super important, no matter if you've had Lyme disease before or not.
Speaking of tick prevention, this deep dive has definitely made me more aware of those little guys and all the trouble they can cause. Any last bits of advice for our listeners on how to stay safe and avoid tick encounters?
Preventing tick bites is all about being prepared and knowing what to look for. First things first, know your enemy. Get familiar with what Ixodes ticks actually look like. Remember, those tiny nymph ticks can be super easy to miss.
And remember, they're not just hanging out in the woods, right? They could be in your backyard, the local park, even your garden.
Exactly. So if you're spending time outdoors, especially in areas with tall grass, bushes, or woods, you've got to take precautions. Wear light-colored clothes so you can see ticks easily, tuck your pants into your socks, and use insect repellent with DET.
And don't forget to check yourself thoroughly for ticks after being outside.
Absolutely. It's a good idea to have someone help you check those hard-to-see spots.
Yeah.
And if you do find a tick, remove it right away. Use fine-tipped tweezers to grab it close to the skin and pull straight up with a nice, steady pressure.
And if you start having any symptoms that seem like Lyme disease, like that rash or those flu-like symptoms, don't wait around. Get to the doctor.
You got it. When it comes to Lyme disease, early treatment is key. The sooner you get diagnosed and treated, the better your chances are for a full recovery.
Well, I think we've covered pretty much everything about Lyme disease. We've talked about those little bloodsuckers, those complicated tests, and the mysteries of those long-term effects. This has been a truly deep dive.
It really has. I hope our listeners feel more knowledgeable about Lyme disease and that they're better prepared to prevent it and even handle the challenges it can bring.
Absolutely. Knowledge is power, especially when it comes to our health.
Well said. And just remember, there's always more to learn. If this deep dive has sparked your interest, keep exploring. There are so many great resources out there, from reliable medical websites to patient support groups. Stay curious, stay informed, and most importantly, stay healthy.
Thanks for joining us for this Lyme disease deep dive. We'll see you next time for another fascinating exploration of the world around us.